I'm from the University of Wisconsin. Thank goodness I have a green shirt underneath the sweater. Um, so when you think about climate change, it's a daunting challenge. And it's just overwhelming how hard it might be to tackle the problem. But through a health lens, I think tackling climate change or climate solutions are health interventions that could represent the greatest health opportunity of our lifetime. And if you look at just three of the main sectors of greenhouse gas emissions, there are enormous health benefits. For example, the energy sector. Air pollution kills 8 million people every year. Of that 8 million, 5.1 million people die prematurely, directly attributed to burning fossil fuels. This is the latest report out of the British Medical Journal. In our group, we've asked the question, what would happen if the United States decarbonized across sectors? And we found that 53,000 lives would be saved every year. That's equivalent to more than $600 billion in avoided mortality and hospitalization. So enormous benefit to get to clean air quality. The food sector. We all know that we eat way too much red meat and it's not sustainable. If the world followed the healthy reference diet, which is mostly the Mediterranean diet, plant forward, very little red meat, that would save 11 million lives every year. Dr. Valerie Stahl in my group looks at sustainable food systems and we're working with mini livestock, and she's growing black soldier flies and insects for protein, and we've published with Harvard scientists about 5 grams of protein would reduce millions of iron deficiency and folate deficiency around the world. So opportunity through sustainable food. And finally, the transportation sector. Because of the private motorized vehicle, we have sedentary lifestyles, and a study that looked at how much active travel there is around the world. Riding bikes and walking for commuting saves already almost 4 million lives a year. We have in our group the health-oriented transportation model. It's a HOT model. And so we're looking at quantifying if you were to switch from automobile travel to active travel, you save lots of lives. And the average bikeability in the United States is less than 1% commuting. If you reach the level of Madison, Wisconsin of 6%, that saves 20,000 lives every year. If you got to Amsterdam and 40% bikeability, bike commuting, that's 70,000 lives. So golden opportunity, and we have one of those new NIH centers, Health First Climate Action Research Center, where we are really looking at how beneficial getting to a low carbon economy can be. Thank you.